Hi, my name is Julian. Today I'm going to be showing you guys how to do a subcutaneous injection. So the first thing I would do is I would assess the patient and get an account of their medical history and the previous medications that they've taken. The next thing I'm going to do is I'm just going to state the 6 patient rights. So name of patient, medication, dosage, route, time, and then documentation. The 3 patient checks are when you remove medication from the Pyxis, after you prepare the medication, then again at the patient's bedside. So now that I've done all that, I'm going to go ahead and I'm going to check the MAR. So I see that the patient is Diana Ramo. The time is 9 p.m. 11/25/20. The medication is Lantus Glargine, 30 units is the dosage, and then this is going to be a subcutaneous injection. Previous insulin injections were done in the posterior arm, so today we're going to do this medication administration in the abdomen, and typically this is administered 1 time at night before bed. So now that we've gone through all of that, I'm going to perform hand hygiene. I'm going to grab my medication from the Pyxis and check my vial. So this is Lantus Glargine long-acting insulin for type 1 diabetes, and that is correct with the MAR. So now what I'm going to do is I'm going to take some alcohol swab and I'm going to clean off the top of the vial. I'm going to take a U100 syringe and I'm going to put 30 units of air into that syringe. I'm going to put that into my vial, and I'm going to deposit the air into the vial. Now I'm going to flip the vial over, and I'm going to pull out 30 units of insulin into the syringe. Now that I've done that, I'm going to use a one-handed swooping technique to get the cap on the insulin needle. Now I'm going to check against the MAR again, make sure this medication is correct. Now that I've done that, I'm going to take this into the patient's room. Hi, my name is Julie, and today I'm going to be doing your insulin injection. Can you just tell me your name and date of birth? Okay, I'm checking your wristband. Okay, great. Do you have any allergies? Okay, so now I'm going to close the curtains for privacy, and then I'm going to conduct hand hygiene and then put on a pair of clean gloves. So for this procedure, I am going to administer an insulin injection in your abdominal area. I'm just going to squeeze up the fat tissue, insert the injection, insert the needle, slowly push in the insulin, pull the needle out, hold some gauze over it for 30 to 60 seconds, and then I'll document and we'll be good to go. Is that okay with you? Okay, so your 6 patients' rights. Your name's Diana Ramo. The time is 9 p.m. on 11/25/20. The medication is Lantus Glargine insulin for type 1 diabetes, 30 units in a U100 needle. The route is subcutaneous, and then afterwards I will be documenting this for you. Okay, great. So now I'm going to grab gauze between my 3rd and 4th fingers and grab the insulin, decapping it to not contaminate it. So I'm going to grab it with the fat with my non-dominant hand, and then I'm going to clean with the alcohol swab and then dispose of that in the correct location. Now I'm going to insert the needle at a 90-degree angle, squeezing up some fat. And because the patient has some extra fat on them, that's why it's a 90-degree angle. So I'm inserting it, darting my wrist quickly, inserting the insulin slowly. Then I'm going to take gauze between my 3rd and 4th fingers and cover that over the injection site as I pull out the needle swiftly. Then I'm going to dispose of the needle in the sharps container, and then I'm going to hold this for 30 to 60 seconds. If this was a heparin injection, I would hold it for a little bit longer. So actually it's 30 seconds or under with insulin injections, 30 to 60 with heparin, just because it's an anticoagulant. So once I've done that, I'm going to dispose of my gloves and then clean up the area. I'm going to put the patient into a comfortable position if they weren't in that position before, and then ask them, do you have any complaints about the medications that were administered? No? Okay, I'll be back in 30 to 60 minutes to check and see how you're doing, and then I'll put the other supplies that I had away, and then I would do documentation. So for documentation, I'm going to say medication, Lantus Glargine, long-acting insulin, administered 30 units at 9 p.m. on 11/25/2020 to the patient, Diana Ramo. There were no patient complaints. and I'm going to sign that J capital H O U S N. Thank you.